All
Hey,
right, Leslie, you're good to go.
thank you so much. Happy Monday, everybody. I know I already said that, but I'll say it again. I'm glad to be back. I missed you all. Um, hopefully you didn't miss me. Hopefully, you felt very supported. I think based on what I've been doing for catch up so far, it looks like you had some great support while I was gone, and Lisa and the rest of the team, and Nancy and Angela and everybody. So first, I want to thank all of them for filling in for me for the past 2 weeks. I took a much needed vacation, and I appreciate all of you being very patient and understanding while I was out of the office for a couple of weeks. It was really good to take a break and get rejuvenated and come back ready to keep things moving and get things resolved for you guys. So, the first order of business is I just want to let everybody know that this meeting series is due to end on the week of May 20th, this one and the provider series. So I did discuss internally about extending that because we aren't as far along with the issue remediation as we had anticipated being right now. So we definitely don't want to leave you guys um, hanging while we're still resolving the bulk of some of these issues. So we will extend these meeting invites out to the first week of June. So June 3rd through the 7th. I'll work with Miranda and Nikki to get those extended out for you guys, and I'll let you know if there's anything that you need to do. But I think if you're already registered and they extend it, you shouldn't have to do anything to have those show up on your calendar. Um, Once we get to that week, if we feel like we need to extend it further, we certainly can do that as well. We definitely want to make sure that you're supported as we continue to resolve the issues that were tracked after our deploy. Um, so before I go into the Q&A and answer questions from the Q&A, I did want to give you guys a list of the items that were deployed into production on Friday. We did have a production deploy on Friday night, and several items were resolved as part of that deploy. I will also be sending out a weekly communication, probably on Wednesday, with this same list of items. So don't feel like you have to write it all down, but I just wanted you guys to know as soon as possible what items were resolved. So I believe that the person banner, that green person banner, should now be showing the correct person status for individuals who are receiving targeted case management or Section 13. So if an individual, a person in Evergreen has been found DD eligible for developmental disability services, and they have accepted case management and their case manager has been assigned in the Evergreen system, then their person status should show as Section 13 now. Once they apply for a waiver and are made an offer and accept that, and then they're classified, that would then update to their waiver program. But in between being found DD eligible and getting on a waiver, if they have accepted case management and have an assigned case, actively assigned case manager, should show as Section 13 in that banner now. Also, there was an issue that was reported with a comprehensive assessment that when a community case manager was creating a comprehensive assessment form, the overview section was showing the community case management supervisor name in both the community case manager field and the CCM supervisor field. That has been resolved, and it should now be showing the case manager in the case manager field and the community case manager supervisor in the supervisor field. There were several items related to PCPs and SIPs that were resolved with Friday's deploy. Around the PCP, the annual date range had not been updating automatically to the next full plan year when you revised a PCP to type annual. But that has been resolved, so you shouldn't have to go in and edit that yourself now. So if you revise a PCP as a type annual, it should automatically increment the plan effective date range by one year. You can still modify the dates if needed, but you don't have to now. It should automatically do that for you. The community case manager role was also unable to complete the 90-day review type PCP because under the medical review date section, the selection options for medical professionals was giving that options are loading and it would just keep spinning. That should be resolved as well as of Friday's deploy. Community case managers weren't able to complete PCPs that were revised from migrated PCPs because the plan's signature completion requirements were displaying as not met when both the self and case manager signatures had been captured. That should be resolved now. So you should be able to revise from a migrated PCP, and if you capture the correct signatures for the person or self and the case manager, it shouldn't tell you that your completion requirements are no longer met. It should show those as met, and you should be able to set those plans to complete now. Also under plan signatures, for PCP type of change, when there was a change in, when you selected a change reason of change in goal, change in service support, change in service implementation plan, or change in rights, supports, and modification, there were some issues with the completion requirements that were not allowing you to complete those PCP change types. Those also should be resolved as of Friday. And the CCM supervisor role, community case management supervisor role, was receiving an error when trying to select save on the SIP template section of a section 21 PCP SIP. That error was, you do not have permission to perform this action. That should be resolved as well. So I think community case managers were having no trouble with that, but community case management supervisor role was, and that should be resolved now. I don't know if Liz Hardink is on the call, but if you are, Liz, this one is specifically for you, but your BI case coordinator role wasn't able to create section 18 PCP. You were getting an error, and that should be resolved as well as of Friday's deploy. And also, I don't know if there's any of our data and compliance team is on the call, but if anybody is, when you all were viewing the PCP, you weren't being able to, section 18 PCPs, you weren't seeing all of the sections. You weren't being able to see the PCP meeting facilitator, my goal review, and change and waiver service sections, and you should now be seeing those as of Friday. And as it relates to prior authorizations, there was some, for if Emily's on or anybody on Emily's team or Liz Hardink's team that are BI care monitors or resource coordinators, the MIMS PA error file that returns, or the file that returns telling us that the PAs were processed, if there were errors in that file, like MIMS wasn't able to process a PA for some reason, that error message is supposed to display in the Evergreen user interface under the PA itself. And it wasn't updating with that detail. The information was still in the file, but it wasn't updating in the user interface. It should now be updating in the user interface. You should be able to see that without having to go to a report for that information now. And then for adult protective services and public guardianship conservatorship, I don't know if there are any folks on this call that are in those roles, but if there are, there was an issue with the court information workflow history. It was displaying the APS report workflow history instead of the court information. That should be resolved now. And there was, under the person record, there were some Evergreen production contact information, addresses and phones that somehow didn't migrate back into Evergreen when we did the deploy on February 20th. Those should have been repopulated for you as well for Guardian reps. If you saw that some of those details were missing, they should be back in Evergreen as of Friday evening's deploy. So those, quite a list, but those are the things that did get fixed in Evergreen production on Friday evening. And this evening, actually, hopefully right now, we have some more items that our vendor has made fixes to that are moving into testing for our team. And it is quite a lengthy list, but I did want to keep you updated on what is in testing right now. Again, I need to asterisk this with there's no promises that all of these items will pass testing, but those that do would make it into our production deploy on May 17th. So there is a fix in this in testing right now for the behavior management plan. So when you revise a behavior management plan, it was copying forward the attachments from the previous version. That will no longer happen. It will clear those out if that passes testing in this round appropriately. We should be uploading the new attachments for BMP when it comes time to revise those. Under the person summary section of the system, the reportable event provider role wasn't able to see the active assignments. That is also in testing right now. So if that passes, reportable event provider will be able to see the assignment sections, active assignments in the person summary. There are a couple of items in testing for comprehensive assessment right now. One related to when a community case manager is creating the form, the overview section. Oh, no, sorry. I already got that one deployed already. So there's only one item in testing for the comprehensive assessment right now, and it's related to the QIDP signature. So the comprehensive skills and abilities QIDP signature was not editable for our program management staff. So they couldn't meet the completion requirements for the comprehensive assessment. That is in testing. And again, if passes, would deploy into production on the 17th of May. Several items related to the PCP and SIP. So I'm going to try to blow through these pretty quickly. Apologies if this is a little bit too rapid fire for you, but I want to make sure we save time for questions and answers. Don't see any questions in the Q&A yet, so definitely find your Q&A and pop your questions in there if you have any. Hopefully you guys are able to do that. But under the PCP and SIP in testing starting tomorrow morning will be an issue related to the PCP custom list page where the ellipses, that three little dots to the far right of a row, a PCP record row, that ellipses was disappearing and the back button was becoming disabled after you tried to click on an inactive row. So like if you had several PCPs and you tried to click on an inactive row, it was making your ellipses disappear from all the rows and you couldn't use your back button. So that is in testing right now and hopefully be resolved mid-May. The issue with PCP key milestones not copying forward when you revise a PCP as a change type from an annual. That is also in testing. So hopefully you won't have to keep manually re-entering those key milestones when you're revising a PCP as a change type. And then when there is more than one active community case manager or community case manager supervisor assigned for the same location on a person record, there was some question about which one is pulling into the PCP and why. So the logic behind that is that if there is a person record that has multiple active community case management assignments, it's going to pull in and display the one with the earliest start date. So if you are finding that that's not the right case manager, then let us know and we can inactivate the case management assignment that is displaying erroneously and then potentially reactivate it if that person still needs the active assignment so that the other community case manager will be the one that's pulling into the PCPs. Also around PCPs, the community case manager cannot complete the PCP from these are revised migrated PCPs. They can't complete the PCP because the signatures, oh, just kidding. I think that deployed as well. Sorry about that. I got some duplicates in here. And that one as well. I think that's right as well. There is an error message that's being thrown for migrated PCPs when you're trying to revise them, that's saying some error has occurred, and it's related to those migrated PCPs that have the medical review dates section migrated with a physician assistant instead of a professional medical contact. So that error is also the resolution to that error is also in testing right now, or will be this week. The CCM supervisor role was also, or is also, getting an error that they do not have permission to perform the action when trying to save section 21 PCP for the subsection of review active plans and addendums. So that resolution to that issue is also in testing right now. And then for service implementation plans, the missing waiver service fields related to unit rate amount and duration. I think those were the only two, or maybe it's three, sorry, units, rate amount, and duration. Those fields should be added back if it passes testing, and you should be able to see those again by the middle of the month. And then we have the large issue around notifications we had to turn off. As you know, we had to turn off PCP, service implementation plan, PA notifications. The PCP related notifications are in testing, or will be in testing tomorrow. We are also hopeful that we'll be able to pull the service implementation plan and prior authorization notifications into testing next week. But I don't know for certain whether or not we'll be able to do that ahead of the May 17th deploy. But right now, that is our hope, is to get those into testing next week so that all of the notification issues could be resolved together. Related to prior authorizations, there was an issue for Emily Kalifarski's team, who have the dual role of resource coordinator and resource coordinator supervisor. It was triggering an error for them to ensure that all completion requirements are met before proceeding further when trying to deny prior authorization. That resolution is also in testing right now. And as it relates to reportable events, the duration of restraint times wasn't calculating properly. So that's also in testing. For classification, reclassification packets, there's some updates happening for Alexi and Donna's team, where the resource coordinator and resource coordinator supervisor roles will be able to do those attachments. So hopefully that passes testing for you guys. And then just a grouping of other items that are also in testing. There was an issue found with the MIMS physical location addresses not updating correctly in Evergreen. So they're coming across in the files that we receive from MIMS, but they're not updating correctly in the user interface. So that resolution will be tested over the course of the next couple of weeks. And this should resolve some, if not most, of the location address issues that were still being reported to us. So fingers crossed that passes testing. We can get that deployed for you guys. In the appointments and meetings module, there was a field in the EIS PCP related to like medical appointments. That was called if other, and it was a text field, and that text did not migrate properly when we went live on February 20th. So that data should also be there in the Evergreen appointment note after this testing and resolution on the 17th. And then there was a migration issue for some state staff roles. This shouldn't affect any of the external user roles, but for some of our state staff internal roles, they were unable to see all of the developmental disability person records because there was a person record location assignment that was missing for several of those person records. That is also in testing and hopefully will be resolved on May 17th. And then a person that has a DD eligibility form created, or sorry, I guess there were some Section 18 person records that got DD eligibility forms created for them erroneously. So that should also be resolved. That's in retesting right now. And then the ER disposition form, apparently there's an error that was being that's being triggered for crisis caseworkers when they're trying to complete the form that says the value cannot be null parameter input. This is also in testing and should be resolved by the middle of the month. And then DD eligibility coordinator role, again, this is internal, these are all internal state staff. They needed the ability or access to the attachment categories for acknowledgement signatures and additional DD eligibility documents for the DD eligibility form. And that also is in testing. And we do have a couple of items that are in testing as well for our adult protective services and guardianship conservatorship users, our release 2 users, where the guardianship conservatorship status was not displaying on that person ribbon, that green person banner ribbon. That is in testing, should deploy at the middle of the month. And public guardianship representatives were not being able to see all the guardianship conservatorship clients. And that also is in testing and should be resolved if it passes testing on May 17th. And then the last one for that group was if there was an APS report, if there's an APS caseworker assignment on an APS report, and then the client was transferred to another district and then back to the originating district, they were unable to reassign the same caseworker. That issue is in testing and hopefully will be resolved on May 17th as well. So lots of items in testing. There might even be a few other ones that were super low priority that you weren't really aware of that I didn't rattle off here. Or they might have been unique to one specific organization or user or something like that. So I didn't bring all of those up, but there are, as you can tell, several items in testing. We're very hopeful that they'll all pass testing and that we'll have a big deploy on May 17th, but we'll try to keep you posted as we move forward. And then just a couple of quick items that I wanted to follow up on from the past 2 weeks before I go to the Q&A. I do see we have some stuff in the Q&A, which is fabulous. But just a couple of quick items that we were unable to answer for you, or I wanted to reiterate from the past 2 weeks. So there was a question around the behavior management process for ICFs, Section 50. I think the response was provided, but Lisa was a little unsure what the actual process was supposed to be. So I just wanted to reiterate that for ICF Section 50 ICFs, you should continue to use the ODES crisis email process. You will continue to use that email process for the foreseeable future, I guess I should say. There is no plan for ICFs to have the ability to enter behavior management plans and submit those in the system. So if you need to submit a behavior management plan, please use the ODES crisis email process. For everyone else, it is intended for you to fill behavior management plans out in Evergreen. And community case managers should be able to do that right now. PCP data entry role, which is your provider user, the provider user role, you can create, I believe you can create BMPs right now, but the problem that you're going to have is that you cannot add the attachments still until we're able to resolve the attachments issue, which hopefully will be coming up here soon. It's not in testing yet, but hopefully later this month. So hopefully by the end of the month, we'll be able to get that resolved. You will not, as a PCP data entry role, you will not be able to submit those BMPs still in the system because you can't add all the attachments that are required for the behavior management plan. So you will need to still fill out all the forms and provide those to the community case manager and ask them to enter the BMP for you until we're able to get the attachments issues resolved and get you that access that you need. As it relates to positive support plans and functional assessments, as providers, you should still be filling those out on paper. Those will always be filled out on paper. Unfortunately, again, because of the attachments issue, you still can't upload those into Evergreen, but you should still be completing them. And once we are able to resolve that attachments issue, again, hopefully by the end of the month, then you would be able to upload those PSPs into the Evergreen person record. And then the last item I wanted to follow up on from the past couple weeks was there was a question, I believe last week, related to the reportable event provider follow-up form. And the question was, will there ever be a time when internal review and remediation steps will no longer be mandatory for all reportable events? I did follow up with Steph Barrett on that. She indicated that there is no plan for or time frame for these fields to no longer be mandatory because CMS does require that all events are reviewed, evaluated, and remediation applied to reduce the likelihood of it happening again. So these data points are being captured for to comply with Centers for Medicare and Medicaid Services requirements. So there is no plan for those to not be mandatory. So with that, I will switch gears from my notes and move over here to the question and answer. So the first question that we have is, a CCM has a plan that he cannot get past the signature requirement. The most likely problem is the guardian signature box did not populate in the plan signatures, but did in the meeting signatures. He has gathered signatures and uploaded them both as attachment and in the self-signature field with a note that the guardian signature did not populate. However, the plan progress remains incomplete, preventing the CCM from completing a plan. How can we proceed without having to redo the plan again? Great question. So we are going to be in testing for those signature issues. Hopefully those will be resolved with the deploy on the 17th. In the meantime, I don't know whether Emily or Alexi is on the call, but I think that we were saying as long as the plan signatures have been uploaded and attached, even though the PCP is not set to complete, that we can proceed with implementation of the plan. And I believe it looks like Emily's typing an answer to that. Yeah, and we can manually create the prior authorizations if needed, while we're waiting for that to get resolved. So thank you, Emily, for chiming in.
Leslie, it seems like there are several questions around signatures and it not allowing them to save the plans or move the plans. I know that in some situations we have been able to help, so I don't know if they want to send some of that information in so that we can take a look, just so that we're not creating auto auths if they're not necessary.
Yeah, manual auth if they're not necessary.
That's what I meant.
Yeah, so yeah, that's a great suggestion. So if you're in this situation where you're not being able to set the plan to complete because of the signature completion requirements, but you feel that you've met them, definitely feel free to send that information into evergreen.dhhs@maine.gov. specific person ID and person-centered plan form ID, and indicate that this is a scenario where you've captured the signatures, but you're not able to set the plan to complete. And we can make sure that those that are monitoring the evergreen.dhhs@maine.gov email box know to kind of forward those along to Nancy and Udaya for review. And then if there are any that we can help you set to complete, we will. And if not, then we'll just let you know to reach out to your resource coordinator and let them know, and then they will help you manually until that gets resolved. Thanks, Nancy. So the next question is, staff have a notice to follow up on a reportable event, but they are not able to click on the notice. The notice is to follow up on the reportable event, but the reportable event has been followed up. Will this notice go away? So I think you're saying notifications. You're getting a notification related to a reportable event that requires follow-up. So Allison, apologies, I assume you're a community case manager. So if you are a community case manager and you're receiving a notice that you need to do a follow-up for a reportable event, in order to stop receiving that notification, you'll receive that notification every day until you go into the reportable event and set the status of that reportable event to acknowledged. So you need to review the reportable event and then go up to the status bar and confirm that reportable event, and then that will set it to a status of acknowledged, and then you'll stop receiving the daily notifications. Once you've done that, if you want the notification to go out of the view of your notifications box, you should be able to select that notification row by clicking on it. It will check the little box at the left of that row, and then you should be able to set that notification to archive, and then it will go away from your notification view. I can actually maybe show you how that archive function works. Let me see. Give me just a minute here. So in here in notifications, once you've navigated to a reportable event, it will show up as unbolded. Actually, I'll show you where that acknowledges while I'm in there. Hopefully I can. So in here, in order to stop receiving the notification, this would need to be completed. And then once it's completed, there will be a new option here that says confirm, and you would need to come in, review the reportable event, and then click confirm, and then it would change the status to acknowledged, which will make your daily notifications stop triggering. You can see here on this one that I put in here, it keeps triggering me a notification about the same reportable event because I haven't completed it. But once you navigate in and review it, it will show up as unbolded. Once you've taken care of it, if you want it to go away, you can just simply click here and then use this archive function, and then it will archive that off so it doesn't display in here for you anymore.
Leslie, I took it off, but a follow-up question might be how to go back and find those archived messages. Because we worked with somebody at one point and we showed them how to go find them again once they archived them.
I am not even sure how to do that. Oh, I'm not sure how you do that.
Hmm.
You were able to show them the archived ones again?
Yeah, I forget who it was we were working with. I think it was Yeah, we can save it for next time.
Yeah,
Can you hear me?
yeah,
Yeah,
Are you
Lexi.
talking about the notifications for archive notifications? Is that what you were saying?
Yes.
yeah.
You have to go into the advanced search button and then put their ID and then click archive to be able to
There
find.
you go.
Okay, hang on, let me
So if you want to screen share them,
let me see. So
So
after,
yes, put the person ID up top and then down below, click archive, and that'll pull up all the archived notifications. But you won't be able to click into it. You'll just be able to see it unless you unarchive it.
oh, thank you. Thank you, Alexi.
You're welcome.
So hopefully that was also helpful. Okay. So let me go back here. The next question is, it looks like there still cannot be 2 open PCPs at a time. When is estimated to be fixed? I do not know where that one is on the list of resolution. So I will take that back and try to get some information on that for you.
Leslie, I don't know where we're at that with that either, but I think if you want, I can share some guidance we've been sharing with people,
Yeah,
just so that.
probably.
So unfortunately, it's not ideal and it's not fantastic, but it is what we have to work with the system right now. And what I've been telling people, if it's a 90-day review, if you have a plan open or you're working on your annual and you have to do a 90-day review, we've suggested that they capture that in the annual plan in the meeting minutes, just that it took place, so that they have it captured somewhere that they did a 90-day review, even though they can't put it into a 90-day review. And also suggested they follow up with a progress note that notes that as well, and then just keep going with that annual plan.
Okay.
If it's for a change though, a change in service, and they cannot wait until the annual PCP that's coming up, that's why they have the annual open. Unfortunately, the only way to really resolve that is to close that annual plan that they have open and go back and do a change in service to get that change in service done before they go and revise as an annual again.
Okay.
At this point, that's where we kind of are with guidance.
Thank you. That's helpful. The next question is related to, or actually, I think it's a new issue, maybe that's being reported. I saw an error today in which the PCP won't complete because it is said the plan signature is not there. Yeah, no, I think this is actually a known issue, Megan. So it isn't, those errors are in testing right now. So hopefully you have the information that you need on that. Yeah, this is another one related to after upload, the signature is still showing at needed, so case managers cannot complete the plan. So we've responded to that one. Is there a plan for case management progress notes to calculate units properly? So, Melinda, I think you're probably referring to partial units, because I believe that there isn't really like a calculation besides entering the minutes in there. I think the hours and the minutes, and then it translates it into 15-minute units. I think. So the guidance here is that when organizations, when case management agencies are doing their billing, if there are partial minute calculations that need to be done, that will need to be handled by you outside of the Evergreen system and entered correctly in your claim. This question is related to, can you please clarify what attachments you're referring to with the resource coordinator and reclassification? Yeah, I think, and Alexi, maybe you can chime in here if I'm going astray, but I think in the classification, reclassification packet, the resource coordinator role wasn't able to open the attachments and view the attachments. So I think Alexi, you were having to like download those and share those. Is that true?
That's been solved. That's been resolved a while back. I believe they cannot, and I don't think they can attach documents within a packet.
Okay. So
They can
like
view and open, but they cannot attach them within a packet. So there's only a few that would probably need that function, because most of the time the case managers are attaching, but for
attachment stuff, right? Okay.
non-standard ones that come in.
Non-standard, yeah, good call. Thank you. Yeah. Okay. So this is the exact opposite issue that I just described. So instead of you not being able to view and download the attachments that were added to the packet, you are yourself not able to attach anything. And to Alexi's point, likely the only time that that would be done by somebody on the state side is for non-standard. The next question is any time frame on when we will have access to the attachments tab. Yeah, I don't have a specific date right now, Lisa. I am hoping that that will be resolved by the end of the month, but I don't know definitively yet. So I'll try to give a better update on that at next week's meeting. I just getting back from vacation, don't have a good pulse on exactly where all of our issues are at, but I will take that back as well. And hopefully at next week's meeting, I can give an update on that time frame. Get a quick note for myself. There's also a question related to the service implementation plan. Once a service implementation plan is ready for a provider to enter their service information, can the CCMs please be reminded to email or call to let the provider know that it's ready? Some are under the impression that we are notified in Evergreen and we are not. Yeah, definitely, Carol. I know the notification went out on the 26th while I was away, one of our weekly emailed communications, and there was a reminder in that communication for CCMs and care coordinators to let you guys know, because the notifications still aren't triggering. But I intend to do another weekly communication this week, and I'll continue to provide that message, and also at the Friday provider meeting, I'll remind people again as well. Okay, so I got some additional information on the question from Allison. She is not a CCM, so her question was not answered. So I'm confused then. I'm not sure what sort of a note. I don't know why a provider would be receiving a notice related to a reportable event. Maybe it's I'm not sure. I guess I'm gonna have to go back and find out what notification might be triggering for reportable event provider rule. That question again so that I can try to get an answer to that for you. Okay. Oh, so Melinda's indicating units round to the 60% rule, not the 80% rule in chapter 1. Yeah, so again, in Evergreen, it is going to convert, I believe, hopefully I'm not getting this wrong, but I believe it's going to convert to 15-minute units. And the rounding rules are not accounted for by Evergreen. They need to be handled manually outside of the system, but I'll also try to get some additional information around the rounding rule to bring back next week as well. The next question is, or statement is, in EIS, we had to keep the face sheet updated with all the current medical, dental, vision, medication review dates. In Evergreen, the PCP only has space for the med review dates. Should we be tracking those other appointment dates in the PCP in the meeting narrative? I know that there is an appointments tab to be using, but can that info populate into the actual PCP somewhere? Yeah, so I believe, Lisa, if you are entering the appointments in the appointments module, it should display those in your PCP for you. Let me see if I can. I'm not sure if I'm gonna be able to show this easily, but let me see if I can try to find a way to show you this. I don't have the plus new appointment. So that's not helpful. Let's do it from here. So in here, under the appointments and meetings module, if you select like vision or dental, like you were indicating, and you put in the information here. Then this I believe the PCP will display any upcoming appointments, or I'll say active appointments, in the, let me see if I can see one in here. I don't remember what section it's under though. Vacation review date. Yeah, so right here. So in this, I obviously this PCP was already in progress, but like right here under medication review dates, it's saying no medication review date records available because there wasn't anything on my person's appointment list when I created this. But if I had already put those future meetings and appointments in there for PCP, vision, dental, then it should show you each of those in here when you create your PCP or revise your PCP. It will go look and find the right medical appointments from your appointments and meetings. It looks like Anne Marie is also receiving those reportable event notifications for somebody that's no longer with their agency. All right, I'm gonna have to look into that reportable event notification question. I'm not sure what's going on there. All right, so I will try to get back to you, Anne Marie and Allison, on the reportable event notifications, and also just anybody else who might be experiencing that same thing. I'll try to find some more information about that and get back to you guys. I don't see any more questions in the Q&A. Oh. Yeah, thank you, T. Yeah, it looks like notifications will fire for reportable events when both the reportable event and the follow-up haven't been marked as complete. But I didn't know that the yeah, I'll have to look into that a little bit further because I don't know that that's the requirement. So that might be an issue that we need to track. But thank you. That's good additional information. Oh, and Allison is saying that both have been marked as complete in hers. So both RE and provider follow-up. Thank you, Allison. Yeah, I'll try to get some more information on that. So again, I think we've answered all the questions that were in the Q&A. I know I gave a lot of information. Oh, go ahead, Nancy.
I just wanted to follow up with the medical, dental, vision.
Yeah.
I believe if I remember right, it's been a while since we did those requirements, but it's going to pull the last year's worth of data because we used to track what happened during that past year for those dates. So I
Okay.
believe it's going to, I don't think if you put a future date in that's beyond
The
the,
PCP range.
they're looking for in that last year or something.
Yeah. Well, I mean, I'll track a note to find out what the exact requirement is because I thought it was pulling in the stuff that would be happening during that plan year.
Well, let's check because that's not how we ever tracked it before. So
Okay. Okay. I might be wrong.
I assume that we're doing it the same way we did before, which would be we track the events that have happened in that past calendar year.
Okay.
We can confirm though.
Yeah. Definitely took a note about that. Yeah, so again, not seeing anything else in the Q&A. Definitely gave a lot of information about what was deployed on this past Friday and what's in testing. As I mentioned, I will be sending out the weekly email communication this week, probably on Wednesday evening. And I will include the list of items that did deploy into production. I'll also try to give updates on Friday morning's call that are items that are in testing that are relevant to the provider roles specifically. And then at next Monday's meeting, I'll try to give you an additional update on the status of all those items that are in testing. And then some of these ones that you guys were asking about that I didn't have the answers to today. I'll try to find out and get you some sort of idea on where they're slated for resolution at next week's meeting. And we have a couple of things we need to follow up on as well, some questions and a possible issue around reportable events notifications that we need to follow up on. So Nancy and myself, Lisa will take those back and we'll get working on them for you. But thanks again, everybody. Happy Monday and glad to be back and hope to keep things moving for you. Have a great evening.